This is Matt Walsh with your Minute with the Mayor for Monday, April 13th. Locally, the number of confirmed COVID-19 cases in Council Bluffs stands at 13. 8 of those patients have recovered. There are no reported exposures in any of our long-term care facilities. The estimated need for regular hospital beds, ICU beds, and ventilators currently shows that we have excess capacity, but there is continued need for personal protective equipment for healthcare workers. National modeling that's being used by health officials estimate that the number of deaths per day in Iowa will steadily grow by 1 additional death per day until we reach a peak of 23 virus deaths per day on April 30th. The peak in Nebraska is projected for 1 day later on May 1st. After those dates, the death toll steadily declines thereafter. The good news is that as of today, the same modeling had estimated 58 deaths in Iowa, and the actual number of deaths statewide currently sits at 41. This is 29% below projections. Frankly, it's too early to tell if this good news represents a sustainable trend going forward. The estimated total deaths in Iowa by August 4th of this year is projected to be 743 Iowans. Hopefully, by diligently practicing the prescribed health protocols, we can reduce those projections substantially. On world news, they're reporting new outbreaks in China after they lifted their isolation rules. The facts behind that story are, in a population of 1.4 billion people, they have only 169 new cases. Over 100 of those 169 cases were contracted outside of China, with the majority of new cases in northern China, which shares a border with Russia. Chinese residents who travel to Russia make up 60 of those imported illnesses. Russia was late to the infection, and they currently are showing growth in their confirmed exposures. On another topic, Los Angeles County is conducting antibody testing. LA County has more population than 40 out of 50 of our U.S. states. So this may give us a better idea of how many people were exposed but are asymptomatic, showing no symptoms. Early estimates were that 20% of those who were exposed were asymptomatic. Recently, scientists believe that number of asymptomatic exposures might be a much higher percentage, maybe as high as 40%. If more individuals have been exposed to COVID-19 virus and subsequently they have developed antibodies to help them fight the COVID-19 antigen, then that's a positive component that can be factored into the decision when to reopen the economy. I'd like to give a special shout out to Matt Walsh of Pottawatomie County Public Health. He and his staff are working diligently to stay on top of our health concerns. Thanks to the Council Bluffs public safety employees, police, fire, and public works, daily they accept the risk of exposure to the virus while protecting our citizens and transporting patients to the hospital. I'd like to thank our grocery store workers and our over-the-road trucking fleet who make sure that we have food to eat and the essentials necessary. And then most especially thanks to our healthcare workers who risk their lives on the front lines. That's your Minute with the Mayor.